Well, Dr. Martin, we talked about missing teeth. Tell me, what are the preferred or the currently available methods of replacing a tooth? And give us, the real small but big picture about it, since we can't explain each one in great detail here, but give us the pros and the cons of the several methods which are out there to replace missing teeth.
Well, at this point in time, the ideal way to replace any missing teeth is with an implant. And for those who don't know what the implants really do, implants is something where you actually put a root in the bone where you had the tooth. And so basically it's replacing your root. And then we will attach a post to that root and put a crown over the post and make it look just like you have a tooth coming out of your gum.
And that root is made out of what?
Out of titanium, usually. And it basically incorporates into the bone. The bone actually incorporates into the root. And rather, it's on long term, it's really stable. In terms of having implants done, with the patients that I've worked with, how most people will refer to like a dental procedure having some kind of pain associated with it. Implants, I never really get many patients who complain about any kind of tenderness or anything. They usually go through that pretty well. So that's one way to replace your tooth. The second way would be what we call a bridge, where we would cover the two teeth on each side of the space. One tooth on one side of the space and the other on the other side. And we actually put like a crown or some type of attachment to those two teeth, usually in the form of a crown. And those three teeth are incorporated as one piece to fill that space in. That would basically probably be
the third one, which hangs in it. The third one hangs like from a bridge. Right. Here's the two teeth, and it also gets a crown on it, right? It gets a cap overset, and then a third one hangs kind of in between, like the San Francisco Bridge or the Brooklyn Bridge, right?
Yeah, you could say, basically it's where you have two teeth in a space, which you end up coming up with a bridge. You have two teeth and another tooth in between. And it will look natural, just like it was always there. At least that's our intention. There are some circumstances where that might not be quite possible, but for the most part, we should be able to make it look lifelike.
Can you replace a couple of two or three teeth like that also? Like, can you hang, instead of one tooth, can you hang two or three in it? Basically, you have, two teeth which hold it and two teeth in between, which makes four teeth altogether, or a bridge of four teeth.
There's sometimes where you have to call upon maybe two teeth to hold it on one side and one tooth on the other. In terms of replacing, you really don't want to replace too much more than two or three teeth. That's not really ideal, but sometimes because of the circumstances, you may have to do that.
Okay. What is some of the tell us fast, what are some of the bigger advantages or disadvantages of a crown or a bridge actually versus an implant?
If you have two teeth that look like they need to be restored, then it may be best and more economically make more sense to go ahead and cover the two teeth and then replace the missing tooth with a bridge. If you have two teeth that are in perfect condition, then you really don't want to destroy those teeth just so that you connect another tooth to it. So in that case, I would push for you to do an implant as opposed to a bridge.
Right, because you don't want to destroy the other two teeth. Now let me ask you, what's the longevity of, let's just say, on an average? We know that things like that, since it involves human beings, with different, habits and bodies which act different. But on an average, a bridge, in terms of how long it lasts versus an implant, how long it lasts. What are we talking about here? Is there some data out there?
Well, there is data that would suggest that a bridge, you can expect it to last at least 5 years, and if done well and if the circumstances are good, you can do it. It can last for 10 years, but you need regular maintenance on that bridge. That bridge is not as ideal as your regular teeth, so you definitely need to make sure that you keep an eye on it and maintain the conditions around it. Mm-hmm. With the implant, pretty much the same circumstances exist, but with the implant, I do believe that you can get much more long-term durability out of an implant, because the implant just incorporates into the bone, and if you keep it healthy, the gum around it, you pretty much have the same tooth, and you don't have the possibility of having cavities, which is how a lot of us lose our teeth. With the implant, you basically just have to keep the environment around the implant clean, and that will help keep it healthy. Also, making sure that your bite is evenly adjusted also.
Right. So, well, you bring up a point, I think, which it's like when you have a crown and you have 3 teeth or 4 teeth for that much put together, there's really no space in between, so it's difficult to floss during that time. Does that affect the gum, the maintenance of the gums a little bit? Does it make it slightly more difficult because you have to kind of fiddle your floss through the teeth and stuff like that? That's
correct. Yeah, you have to actually feed the floss under the replacing tooth. You have to feed the floss under there and just make sure that the gum is being stimulated and kept clear of any plaque or debris.
And that's more difficult with a crown and bridge than versus an implant.
Yeah, because with the implant, you're gonna be able to go right in between your contacts and clean at your gum line. But sometimes, even with the right, and sometimes even with implants, you have to like splint them together, depending upon the circumstances. And I think the big thing is that regardless of whether you do implants or bridge or whatever you end up replacing with, you really need to make sure that you make the effort to keep your gums clean of plaque and debris.
Right, because if you don't, you lose it again much faster. It will fail and much faster, right?
Correct. Nothing is ideal as your natural teeth. So when you start losing teeth, you know that you have work ahead in terms of making the effort to keep them.
Right.
Whatever you do.
To go back to the question, what do you think how long an implant on an average lasts? You said 10 years for a crown.
Well, I would think that more like 10 years and maybe even more, because with the patients that I have yet to have to replace the implant, and we're talking 20 years with my early implants.
Right.
But we have some that have just been placed recently.
That's a fair amount longer, so wouldn't be on a long run, actually, let's say you have to do 3 crowns. I mean, because you do a bridge, the 2 tooth and 1 tooth. So an implant might still be a little bit more expensive. But if you have to then do it twice, never mind the fact that nobody likes to go to a dentist too much. That by the time you count the redo, never mind the hassle, as I said, but the money, wouldn't that then by in the long run the implant be actually cheaper?
Oh yes. I mean, ideally, if I had the options, I would recommend implant over a bridge anytime.
I see. Well, all right. Here you got it from Dr. Martin. Thanks a lot, Dr. Martin.
Thank you.